So thank you all for joining us today for this topic. With the work that we do at Gennev with women during peri and post menopause, a lot of times we hear questions about certain aspects of female health and specifically the anatomy component of it that we may have either never been exposed to in our education, depending on what education we had, or it's things we forgot. So today we have two very special guests. We have Dr. Yashika Dooley and Amanda Sipos. I am Kasianchuk, and I am the director of Gennev's health coaching. I'm a registered dietitian, exercise physiologist, and I'm very excited to have both Amanda and Dr. Dooley with us today. Dr. Dooley, can you give our audience your background and your specialty, especially as a urogenital gynecologist?
Yes, thanks again for having me today. So I am a board certified obstetrician and gynecologist. So I did 4 years just learning about general women's health and delivering babies. And then I did an additional 3-year fellowship in urogynecology. So I work primarily with perimenopausal and postmenopausal women, looking at incontinence and pelvic pain and all the things that happen as a woman goes through menopause and beyond.
Excellent. Thank you so much for joining us. Your expertise is going to be wonderful today as we dive into this topic. Amanda, you are another special guest, and you're one of our Gennev behind the scenes employees, but do a ton of work. And you are also a premenopausal woman, which I am as well. And we've had some great conversations. So I would love for you to introduce yourself to our audience and give some of your background in terms of the questions and curiosity you've had about female health since working at Gennev.
Sure. So I'm Amanda Sipos. I am in charge of product management at Gennev on the technology side. So I don't make your lube, but I make sure that you can sign in and talk to all the people that can help you get through this challenging time in life. So Stacy and I, we catch up quite often, and I ask her questions like, hey, what happens when your hoo-ha becomes the desert? Or like, what's the evolution of beginning to end? Like you're born and your hoo-ha looks one way, and then it becomes a jungle, and then it progresses and things shoot out of it like children, and then it progresses again, and what does this all mean, and how do we embrace it, not be scared and excited all at the same time? So basic stuff like that, and I'm excited to get some more answers.
Excellent. Yes, we are. So as we are thinking about our webinars, so many of our webinars do, and we always want to highlight the professionals in this field. But I think it's also important to recognize that our audience has questions, and these are topics that we don't talk about enough. And so today we want to bring more conversation, and Amanda's going to help us do that by helping us through the lens of someone that may not be in healthcare, have healthcare training specifically, but certainly a female interested in optimizing our health and learning about our bodies. All right, well, let's jump in and get started. I know everyone is eager for this. So one thing that I wanted to highlight, again, going back to the women that we work with at Gennev, oftentimes there's gaps, and there's understandably, women don't necessarily understand what's happening during menopause, and that's what we're here to help them with. But I find that there's also a lot of questions around what is this in my body? I don't understand where to put lube. Like, where are all these things? So Amanda, can you start off with you shared some questions already that come up with that you've had, or maybe conversations with your friends, but anything in terms of having a greater understanding of female physiology, anatomy and physiology that would be helpful for you?
Yeah, so I think initially it would be the evolution. We're born as little girls. It's a flat surface for the most part, and then it evolves. And we have a lot of information for the most part. You go through puberty, and like I said, a jungle grows, and you're like, what's this thing, and how do I find it? And then you have a child, or maybe you don't, and then it starts changing again. But there's no like rule book for that, or how it evolves and what that entails. So that's my first question. What's next?
Oh, I would say, I like how you described it. That's really good. So yes, it starts out kind of flat and there's not much there. And then as we go through, you know, puberty and you have more estrogen, everything starts to get thicker and fuller. And so now you have the labia minora and the labia majora. So you have those folds down there. So everything's not as flat anymore. Those are particularly helpful because they help to protect the actual vaginal canal, okay? And then also you have like the clitoris becomes plumper and fuller. And so that's great because now you can have orgasms. And also you have the hair, right? And so like all over the body, you have hair that's kind of growing wild like a forest. And so what then happens, different people, depending on when they get pregnant, hormones are wild. And so all of those things kind of change. And that's going to be very different for lots of different women. But then as you go through menopause, there is decreased estrogen, and it's kind of like you're coming full circle where things start to flatten out. They're not as big and full anymore. A lot of people lose a lot of the hair down there, which again is like all over our body. As you're going through perimenopause and menopause, you're losing hair on your head, under your arms, your legs, also on the vulva. And you lose a lot of the fullness down in the vaginal area. So the labia minora and majora start to flatten out some. And again, like I told you, those are very protective of that vaginal canal. So it's not uncommon that as that thins out, we are at increased risk for getting more infections. And particularly in older women, they show up with lots of urinary tract infections or just irritation in general. So in a nutshell, that's kind of how I would relate what you're saying. And it's just the cycles of the estrogen that's happening.
Mm-hmm. Yeah, that's a good point. I like how you also, there's a natural timeline around these things. This is normal for these fluctuations, and estrogen certainly is a driver with a lot of these.
Okay, I have another one already.
Okay, go for it.
So as you hit puberty and everything plumps out and you're fertile and happy and want to have fun, how do you know, like, if you're having an orgasm, and how do you figure that out? Like, what's your advice? Like, how do you discover that piece of your body, and where do you start comfortably without being ashamed or embarrassed or judged?
So I think for women who are concerned that maybe they've never had an orgasm or they're not sure, the easiest, simplest way is to do like actual direct clitoral stimulation. And so the clitoris is at the top of the vulva. So really, for most women, I say it's like right below the hair. So, and if you feel around, the thing that feels really good when you're like kind of touching it, or it's really sensitive for a lot of people. And I tell most women just like start very gently, and everybody likes that touch to be a little bit different. And for women who have never experienced an orgasm, that's a great way to see what an orgasm feels like, because you are in total control when you do it yourself, and you can just kind of experience what that is like. And for some women, that's the only way that they're really going to be able to have an orgasm, is with a little bit of direct clitoral stimulation in addition to whatever vaginal penetration is going on.
And as that changes through time and that area becomes flat again, and I feel like we're in a time period where like divorce or breakups or transitions are totally normal. But I feel like I know lots of women that are in their 40s and 50s, and they're hitting the street and they're dating again. And now they're dealing with a desert downstairs and approaching conversations about like uncomfortable boning or burning. And like, where do you bring that up? Or how do you talk about that comfortably? And I'm kind of wondering if you have any advice.
Talk about it with their partner, or talk about it just in general?
I think both, because I don't know if it's accepted to talk about it. And I think we should have more of an open relationship with our lady friends. And then I think I'm more interested in like the scientific process that's happening in your body, so that you know how to approach it in an intelligent way with like a little bit more of an upper hand when it comes to that situation. Because if you know what you're talking about when you get there, you're in between the sheets, or you're burning or boning or both. Like I wouldn't want to be embarrassed, and I know my friends don't want to be embarrassed, and nothing's worse than like chafing for no good reason. So
yes. So I would say the first part is all about normalization, right? And I remember a time when we never talked about erectile dysfunction. And then there was a time where erectile dysfunction, like commercials were all over TV.
Right.
And people say it all the time now, right? So it's really just about us making it normal, because if we can talk about erectile dysfunction and my children can see commercials on TV, like why can't we talk about whatever is going on with women? So really it's us saying, no, this is normal, it's okay. And if we can talk about the male counterpart to that, because if they're having, you know, all these medications to get them nice and erect, they need us to also, if they like us, they need us to be ready, right? So I think we need to then make it normal, and we need to take out the discomfort. Just like when we're talking to our younger, you know, girls and saying it's totally normal to go through having a period and your breast develop, like how we choose to talk about it is how people are going to receive it. And if you say it's totally normal to talk about breast development and having puberty and going through menopause in the same way, we make it normal to talk about anything else that is dealing with that. I think when people are talking about having chafing and vaginal dryness and irritation, one of the things that you should realize is men don't need very much if they're not having erectile dysfunction to be ready and to go right into intercourse. Females were much different. We're much more cerebral, and our bodies take a little bit longer to warm up. And so if you automatically go and you're bumping and grinding and moving and it's all very dry down there, it's going to be more irritating. I think oftentimes you need to be ready. If you know that you're the type that it takes a little bit longer for like lubrication to naturally occur, to have something on hand. And I think oftentimes it's great to incorporate that in foreplay so that nobody is irritated, nobody feels like uncomfortable or waiting. But if you actually incorporate even using the lube during foreplay, it makes it so much easier. So I say, you know, you can actually use that to, again, direct clitoral stimulation or putting a little bit of lube on the outside, because that's where it starts. A lot of people have irritation just with penetration. So you want to make sure you're getting the lube or whatever you're using on the outside as well as the inside. If you're having problems with lube on the inside, whatever, like if it's, you know, penile penetration, putting lube directly on the penis so that as you're having penetration, you're not going to be irritated with insertion and initial movement until you have more natural vaginal lubrication. So all of those things are very easy to do. And if you talk to your partner and let them know how to incorporate it, or even if you don't talk about it, but you kind of show your partner what works for you, most partners, like, they love you, they care, they're going to be down for it. They're like, okay, that's easy, you know, and it makes it easier to do, and it makes the transition very simple. I think that's the easiest way to start it. But really, and you'll notice this even with women that have just, if they're pregnant or if they've just had a baby, that's another time where you need a lot more lube because there's decreased estrogen. And so a lot of women will be like, I don't understand why I'm so dry. Well, it's because you don't have as much estrogen right there. And so that's another time where you need to increase lube, especially maybe if you had a vaginal delivery and you had a tear or something. All of those things are going to contribute to any potential pain. And so you want to kind of get ahead of all that by having the communication, having the lube ready, incorporating it into the foreplay. And then even if you need a little bit extra during the actual intercourse, I think it's great, like, right? All of those times, and you just make it very natural.
I love it too, Dr. Dooley. Thank you so much for bringing the driving home the point around the need for conversation, and the comparison to erectile dysfunction with men is often, you know, there was a pill created pretty quickly for that once that conversation came up. So I think we deserve on the female side to have that same thing, and that conversation is so important. So thank you for driving home that point. And also these things are, and making these normalized or natural. You know, there are products on the market. We have different lubricants that we've created. There's other ones out there. You don't have to feel shame about buying these. You don't have to feel shame about using these. They're there for a purpose. And it really is about how can you optimize this time of your life. And this is a part of your life in that point. Yeah. Dr. Dooley, are there common misconceptions that you hear when it comes to female anatomy specifically, or areas where women really don't have the knowledge or understanding, where it could be helpful to just know, okay, this is the physiology, this is the anatomy, and this can help you improve your health or your quality of life?
I always recommend my patients do is just take a look down there,
Mm-hmm.
I think it's really hard when people come in and they're like, something's wrong, something's different, but I'm not sure what. And so they're trying to explain it to me. But if I'm looking at their pelvis or their vagina for the first time, I also don't know, like, is it usually a little bit red there? Is that new for you? And so it's hard. I don't know what your baseline is, right? So if you tell me it's irritated, but I'm looking and I'm like, well, maybe it looks a little pinker or peacher, maybe it's a little blue here. But like for a woman, they'll be like, oh no, that's always there. That's not what I'm talking about. That's so helpful for me because I don't know, right? And so if you kind of know your baseline, and then if a doctor dismisses it, it's easy for you to say, no, that was never there before. That's absolutely new and different for me, right? But if your doctor doesn't know your baseline and you also are like, I don't know, I never looked down there. It's hard then because now I just have to have you come back and be like, okay, let's see if it changes. So I think that's the best way for women to empower themselves is to like, just when things are feeling rather normal, just like stick a little hand mirror down there and kind of look, okay, this is usually the color. This is what it looks like, and then if something gets irritated or red, just like you would do any other time, right? If something's red, you kind of look at it and you're like, is it bruised? What's going on? So that you can then be able to say, no, that's usually not like that. It's usually not that red. It's usually not that full, whatever it is. And then no matter what people say, you can absolutely advocate for yourself and continue to advocate for yourself because that's not right. But if you're not sure and they're not sure, then you're both kind of like stuck in a quandary. I think that helps like to get over the initial hurdle because if somebody tells me, nope, that's not normal, I'm going to listen to them more because I'm like, okay, she says it's not normal. Let's figure it out. The other thing I think women need to do, and a lot of people ask me is like, if they don't take a look or if they feel a bulge or if something's different, it's hard for them to understand what's normal and not normal. So I oftentimes will show pictures in my office and show women what they look like so that they can know what is normal, right? Because sometimes if you just don't know, like you see something, you're like, is that supposed to be there or not, And so even if they have something like prolapse, I'm like, well, it's common, it's not normal, you shouldn't have prolapse, but it's not cancer, right? Because lots of us are just like, is that going to kill me? Should I get surgery for that? So just being able to talk to them about what it is really helps to just calm down their nerves and their anxiety. Even after like a woman has like, babies or whatever, things are different. And if you don't know what's different, or if nobody's ever told you, that's totally normal. You just had a child, or that's totally normal. You've had 4 kids 10 years ago. It's nice to hear that and be like, okay, I don't have to worry about that. That's part of the natural aging process.
No, that's and again, that exploration of understanding your own body then empowers you to take control of your health and to have that partnership, that collaboration with the healthcare provider. That's another thing, talking with a lot of women, that it's not about healthcare providers just telling you what to do. Every woman should feel that they're 100% in charge of their own body. And part of that is that exploration. And then you can capitalize on that relationship with your healthcare provider or elevate it in a way that that serves the woman more. Yeah. Thank you. Great points. We have a lot of take-home points. I hope people are taking notes right now.
Well,
Amanda,
did questions. Yeah.
Did you have some questions, Amanda?
I do. So I feel like the age-old question, or what I heard on the street and talked to my girlfriends, is like, oh, I'm going to the gynecologist. I didn't shave. I didn't wax. Do you think they're expecting a landing strip? What's going on? What if it smells funny? Like, how do I know if it smelled different than last time? Do you think they remember? Is it in my chart notes? Like, are they judging me? Like, is someone judging me when I'm there? Like, I don't know, because I'm clearly spread eagle and like, what's going on? And I can't see what's happening. I can't see their face. Now what? Like, what's the answer? Like, what do you think when we just spread them and you're like, oh, yeah, manicured poorly. That's a light bulb. like, what is that like?
So the answer as a physician, like literally is, it doesn't matter to me. I totally, as a physician, like I see so many, like, I don't even remember it. I would also say though, as a woman, I wonder about those things too, right? So I think as a woman, like, you're more likely to smell yourself, or like, especially if it's like the end of the day, you've been running around. I live in Texas, it's hot, right? And so and a lot of physicians, if you stop them and be like, do you want to go to the bathroom first? If you want to do whatever, I'm like, I think it's fine. You don't have to do that for me. Mm-hmm. But I think that I want the woman to be as comfortable as possible. You don't have to shave, you don't have to do a manicure, you don't have to do all the things, but I feel like a lot of women do, right? And I, as a woman, also make sure that I do those things, because I think it's just we all just want to be as comfortable as possible, because it's such an intimate exam. And it's not like a 5-minute exam. Sometimes they're there looking and you're just kind of like, okay, what's going on down there? I try to talk to the patient, but I think it's also nice if you feel uncomfortable if something's going on, for you to talk to your doctor and make that as normal and as comfortable as possible. So I think, those are all common questions, but I think from a doctor's perspective, you're just like, okay, we don't worry about those things. But I have people all the time asking me. I'm like, if you want to, if it makes you happy, fine, but don't go out of your way just because you're having a doctor's appointment.
I feel like another one I've heard is like, you're in the stirrups and then that like gas bubble drops and now you like don't know what to do. You're like, oh my gosh, like, do I run to the bathroom? Is this gonna rip? Like, is this gonna be mortifying? Like, are they gonna pass out in front of me? Like, what is this?
So I think, and I've done it before, while I've been on the table, I just say, excuse me, just like you would anytime, right? If the gas bubble rips or whatever, like you say, excuse me. I feel like, especially for women as they get older, you have less control of those things, especially if you have urinary incontinence. Women are likely to leak. They might even leak a little bit as they're coming down the table, because that's what causes them to leak. Or they might pass gas, right? Or even some women have like what we call like vaginal farts, where there's gas that gets trapped in the vagina, and as they're moving, the gas escapes through the vagina. Most doctors will just be like, oh, it's fine, I totally understand. Like, part of it is I made you do that because I'm putting you in a situation where that's what your body naturally does, right? Okay. I think it's embarrassing just because nobody wants to pee on themselves or have a fart in somebody else's face. But also, a lot of times when we're pushing on the vagina, or if we're doing a bimanual exam, we realize that we are pushing the gas out. So part of it is just what we are doing during the exam. And so you should not feel uncomfortable or embarrassed, because we as physicians and providers realize what we are doing during that exam is causing the natural bodily functions to happen.
Okay. I have another one.
Such a good point. Go ahead, Amanda.
So you're in your 40s, 50s, whenever you get to, my husband calls it Mandapause, because he likes to pick on me, but when you get to Menopause, and you start feeling insecure about, like, society's image and the societal standard of like, are my lips where they should be? Do I consider a vaginal rejuvenation? Like, is this where I go in and instead of a boob lift, I'm trimming the roast beef? Like, how do you cope with that, or know what you have is healthy and maybe not healthy to be altering that because of the vagina being its own system in itself?
Yeah. So I feel like unless it's a quality of life issue, so unless it's affecting your ability to, have intercourse, have bowel movements, urinate, we would consider it cosmetic, right? And I feel like that's really kind of a personal thing. It's like somebody saying, should I get a facelift or not? Well, if you're 40 or 50, your face is never going to look like it did in your 20s, but that doesn't mean that you can't get a facelift, right? Same thing with the breasts, or if you want an abdominoplasty, right? Like, the way that your vagina and vulva look in the 40s and 50s is how it's supposed to look in your 40s and 50s. And it's going to be a little more saggy skin. It's going to be looser. It's going to, maybe be a little bit more wrinkly. And so now you just have to decide if that for you is the threshold for wanting surgery. And everybody, that's going to be different. I think it's totally normal though. If you decide that you're that type of person, or you want it to be tightened up a little bit, great, go for it. But for us, there's usually, as physicians, there's very little things that we're like, oh, you absolutely have to have that trimmed, and let's just tighten that up and make it look better. Because the alternate side of that, I'm always like, I'd rather it to be functional than beautiful, but like don't touch, right? And that's the problem. You can make it real pretty, but if the person that you love can't use it, they ain't gonna care what it looks like.
All right, fair enough.
And so at the end of the day, you want it to be functional, right? And so whatever gets that to happen. And if you're doing a lot of cutting and trying to tighten it up, but it's a hands-off situation, nobody's happy.
Yeah. Kind of, it comes back to the beauty on the inside, right? It's like wanting to focus on that. And again, bringing conversation to these things of knowing what's normal. If women perceive like this is abnormal, something's wrong with me, I need to fix it, versus this is part of the process. And it's a little bit different than it was 20 years ago. And so are some other things, but what can you do to still feel optimal during this time? Yeah. Well, we've talked a lot about different aspects of the female anatomy, the vagina. We've mentioned the clitoris, the vulva, labia, all different terms here, and the transitions of these during life, or as life goes into peri and postmenopause. And we've talked about some of these normal changes. Are there any that we've missed in terms of how some of the anatomy may change, or the symptoms that women experience during peri and postmenopause?
I think the biggest symptoms are going to be like the vaginal dryness, which most women kind of know about. Coming along with the vaginal dryness can be irritation, right? And so that can be just because of decreased estrogen. I think the other thing that you can always think about is this is a time where you can have more just like yeast infections and urinary tract infections. And sometimes women don't realize that that might be going on. So I usually tell women, if you've never been checked out, or if you haven't been checked out in a while, it makes sense just to have it checked out and just make sure that there's not something that maybe you just need to either get like, you know, an antibiotic for or something. And not just assume it's just because I'm perimenopausal or postmenopausal. Because oftentimes women write things off. They write off their body and they kind of poo-poo their symptoms when it's really something they should at least get a baseline check. And once the doctor's like, yeah, that's fine, then okay, you can kind of continue on and decide what you want. I think that the other thing is that this is a time where natural skin changes can occur. So there are things like lichen sclerosis happens more in postmenopausal women. And that is just where you have just the skin is more dry, and it can happen all over the body, but you notice it more in the vagina. So that's just another thing that you may have vaginal dryness and irritation, and it really does mimic just the normal postmenopausal woman. But unless you're seen, you know, you're going to write it off and think it's one thing, but it might be something that could actually be treated. So again, that's why I tell women, like, at least stop by your doctor or your provider just to get kind of a baseline reading to make sure there's nothing else going on that might be able to be treated that you're saying, oh, it's just because I'm in menopause.
Oh, and that's another good point, where women, we do sometimes put things off, like, oh, no, that's fine. I'll get through this. I'll just push through this. And this is another opportunity where it's learning what is a normal response for your body, but then also areas where you don't have to suffer in silence and try to be the hero of the situation. Amanda, any more questions come up for you?
Yeah. So when you're raging again at like 45 or 50 or whenever that time shows up, first of all, how long does that time last? Like, is there an average? Like, I know there really is. There's like a cycle average of like 28 days, but that's not really real. And then like, what's the average menopause
So I think this is one of the biggest misconceptions. Most people think that, you know, menopause only happens like mid-50s and perimenopause is like a couple of years before and after that. And that is completely wrong. So people can have perimenopausal symptoms and postmenopausal symptoms for 10 or 15 years. So it's not that all of a sudden you're going to start hot flashing and irritation and night sweats and all that is going to end like a couple of years after you go through menopause. And I think the fact that people think it's going to end really is probably what bothers them the most, because they might be like 65, 70 and still having those symptoms. And they're like, I don't understand why it's still happening. And I'm like, well, that's just your body. It's just what's going on. So I think there's a wide range of that. And I've seen women in their 70s that are still hot flashing like they just started. But if you know that like, this is just my body and I'm just a hot flasher, then it's easier to accept. And you're just like, okay, I may never stop. I might die hot flashing. And then, you know, you're not expecting something that may never happen. It's easier for you just to accept it and move on.
So the other part is like when you're feeling that rage again, but you're an adult, you're not going through puberty. You've gone through that cycle already. I mean, me and my partner have this conversation like, hey, I'm taking a walk. Like, taking a walk, like don't touch me, it's like a hot switch, like you're asking for something else if you push it. What do you recommend people do? I mean, some people scream, some people, you know, I know that fitness helps release some of that tension and that anger and energy, but when it happens so fast and there's so many triggers around you, and then like I'm getting anxiety talking about it. So what is the best way to create a healthy boundary distance from the stimuli around you? I mean, some of them you can control, some of them you can't. And just like enabling like the step back and then like breathing through it and waiting till it passes.
So I think one is, once you know your triggers, kind of setting yourself up for success. So one thing that a lot of perimenopausal and postmenopausal women do is, you know, dress in layers, right? So you can kind of feel like, okay, once I get hot, let me be able to take off some layers so I can kind of control that. Some women, they have lots of these like cool packs, and even for sleeping, they have those cool pillows and cool blankets. So it'll kind of help to help you have better sleep. I would also say, you know, a lot of women carry around fans, or they have like, you know, fans in their office. I think any of those things, because when a hot flash comes or when that rage comes, like it usually hits you out of the blue. So I think once you know it's there, being able to like stop and kind of even count backwards and give yourself a moment. I say most people would really say that the hot flash is going to pass in maybe like, you know, 8 to 12 minutes. It seems like the longest time of your life. But like if you just give yourself a moment, you know it's going to pass. I say it's kind of like women that are in labor, right? Like it hits you out of the blue, but if you have already kind of prepared, you know that contraction's going to end, like you're just waiting. You're like, it's going to end. I just need 5 more minutes. Like I think we prepare a lot for pregnancy and childbirth and labor, but we never really prepare in the same way for menopause. And I think if we prepared in that same way, we'd be so much more empowered to deal with the symptoms. People feel caught off guard by the symptoms because nobody tells them what to do. Nobody says, okay, it's going to come, it's going to last 5 to 10 minutes, it's going to be over, and then you can do X, Y, and Z. But if you knew like, okay, it's going to come and I can do these things, and you have things kind of in order, like you'd feel so much more empowered. But I even tell women, if you're having a hot flash, if somebody tells you, I need a second, I'm having a hot flash, you give them a step back, like, right? And so I'm like, the same way if a woman tells you I'm having a contraction, like that room shuts down. Everybody's like, shh. Same thing when a woman's having a hot flash. Just tell people, I just need a second. I'm having a hot flash. I'm going to step out. I'll be right back. Because I think we all understand that's a moment. Like you can't even think straight, right? And so there's no reason in having a conversation. But I think we need to normalize it. We need to have that conversation. But women also need to be vocal. And oftentimes that's a thing that they try to hide, right? A woman has a hot flash, her face turns red, she's sweating bullets, and she's like sitting there, like, I hope nobody sees me. I hope nobody can tell. You know, as opposed to just saying, you know what, guys, I'm having a hot flash. Let me take off some clothes, or I'm gonna step outside. I need a moment. Like that would really help the symptoms so much more, because when you're trying to hide it, it actually makes it worse. Because now your anxiety's like coming up and you're hoping nobody sees you. Everybody sees you, but nobody wants to say anything, right? Like it's obvious when they're having one. So I think if you would just put it out there, then everybody in the room would know, and then you just kind of take care of it, and then you come back and life goes on. Like nobody's gonna die.
Yeah.
Perfect. I have one more question. The sweat, I've heard that your like body sweat changes, and like one of my girlfriends is like, oh my God, I've had this rank boob sweat and I like don't know what to do. I don't like, do I start applying deodorant under my like boobs? Like it smells terrible. I smell it when a hot flash comes on. It's leaking down my bra. Now I'm saturated, and like I feel like all your scents change, which is like, you know, pH wipes, which we have at Gennev, and I have girlfriends that carry them in their purse everywhere. And I don't know what that smells like yet. And I think you should be aware of what you smell like in case you have an infection or something's off. But like, how do you handle that? How do you handle rank boob sweat? Like all these things that start happening.
So I think they do have like different powders and like deodorants and things that you can use. And so I think you can try them. Some women find them helpful. Some women don't really notice a difference. I think for most women, what they notice is that odor, which you can't really get rid of the odor, right? It's just, and so some women, they'll bring like an extra set of clothes, or they'll bring like an extra shirt or an extra bra. Because usually it's after the hot flash and after the sweating, now you're just wet. It's almost like you had a workout, but now you got to work the rest of the day and you're uncomfortable and you feel like everybody can see you. But if you could just go to the bathroom, change your bra or change your your shirt or whatever, and you felt more comfortable, like then you could kind of go on with your day. So I feel like there are things that you just have to feel comfortable doing and just being like, it's okay, right? Again, it's us normalizing it and being like, I had a hot flash and I just had to take that stuff off. Like, yes, I have on a different shirt now. It's not what I came into work with. But if you tell, I had a hot flash and I was wet, it's kind of like if you go work out at the gym, right? Like you would just change your clothes. Like I'm uncomfortable. And once you're comfortable, then you go on with your day. But if you normalize it, then people are just going to go on. I always tell women, most people are thinking about themselves and most people are not going to notice what you wore. Like if you tell them, like, most people look and they're like, oh, okay, you changed. Like I had no idea what you wore. Like, but we are always thinking other people are looking just at us. But most of the time we are only thinking about ourselves, and everybody's only thinking about themselves. So just do what you need to do. Make it normal. It's going to be fine. The more we have these conversations and talk about it, the better it's going to be.
All right.
Such a good point. And I'm going to use that as an opportunity to remind people that if they have questions, now would be the time to put them in the Q&A box or the comment box on Zoom or under the Facebook Live feed on Facebook. As we come into, we have about 10 minutes or so left here that we'll be wrapping up. This is all amazing information. I am finding it very informative as well, and certainly supports our mission at Gennev in terms of really changing how women experience menopause. And it does start with a conversation. We're not going to change the menopause process. And I think science is very far off from doing that as well. So I think it's really more important to embrace that conversation and bring more normalization to that. What do you see, Dr. Dooley, as anything else outside of the conversation, or perhaps how do we help women have the courage to talk about these things? I have a lot of clients that even amongst their friends don't want to talk about menopause, except they all know they're in menopause, but it's scary, it's uncomfortable. How do we support women in having these conversations so we can make this change?
I think one, having these webinars just like this, right? Where you see how comfortable we are talking about it and it empowers you to have a conversation. I would say most women, when they have gone home or they talk to their good girlfriend, like everybody's like, oh my God, you too? I've been having the same thing. Like nobody ever is like, nah, that's not me, especially if you're starting with your close circle of friends, right? That's a great place to start because they know you, they love you, you trust them. And it's a great place to start having those uncomfortable conversations. And the more that you have them, the more that you're going to find kindred spirits. You're going to find your tribe, and they're all going to have the same thing. We're all having those same issues. We just don't talk about it. And the more that we talk about it, the better it is. And it just makes it easier. Like I tell people, even in my house, my kids are probably right outside the door. They hear, I talk about orgasms all the time. I talk about vagina and penis and all that. And that is how we talk in our house. So it's very easy and it's not uncomfortable, but we started that conversation and we continue it and we normalize it. So my kids probably will never feel uncomfortable saying stuff like that because they've grown up that way. We have to now educate ourselves and educate those around us to be like, it's fine. Just like erectile dysfunction on the TV, right? That was never going to be normal until somebody decided, some man probably decided this is what we should talk about and show on primetime television. And so now we do. We have to do it for ourselves though. Nobody's going to do it for women. If we don't do it, it's never going to happen.
Thank you for that reminder here. And we did get one comment that says, a huge thanks to Amanda for going through Menopause and making it so approachable and funny, and to Dr. Dooley for just making it real. So thank you both for that. This person also had a question. She said that she had a hysterectomy nearly 4 years ago. Aside from lube, is there anything else to do for vaginal dryness? She also has psoriasis, so all of her skin is dry, but she's interested in options for vaginal dryness given that situation.
So I guess the one thing I would say is you could always try a little bit of vaginal estrogen. For most women, that's going to be the thing that you need. So lube is good for just in the moment, right? Just while you're having like intercourse or whatever. But to give you that continual lubrication inside the vagina, like at baseline, most women are going to need a little bit of estrogen, especially as they get older. And it's easy to do. And usually you only need it like once or twice a week. So I would just say, just ask your, gynecologist or a family practice, whoever is doing that for you. And it's something that we prescribe it all the time. Super easy. And you'll feel so much better. And you can put that on the inside of the vagina and on the outside. And it really does help with all the tissues.
Excellent. Another question came in about weight gain. What can we do for weight gain? What's your perspective on the weight changes during peri and postmenopause, Dr. Dooley?
So the biggest issue is that our hormones are different. Our metabolism has changed. And even if you're eating exactly like you did, 4, 5, 10 years ago, women have increased fat on their body, which is normal as you age, and you have decreased muscle mass, and all of those contribute to the weight changes. So it's easier for you to put on weight. It's harder for you to take off weight. And because of the distribution or the change between the muscle and the fat, it makes it harder for you to metabolize. And so the things that I would say is you're gonna have to watch what you eat a little bit more, because what you could eat a year ago and not gain weight is not gonna be the same this year. And it's absolutely not gonna be the same 2 or 3 years from now. If you can do any kind of weight-bearing exercises, that's gonna help you put on more muscle mass. That protects you from osteoporosis, which is great, but it's also gonna help you to rev up your metabolism, and you're gonna be able to more easily burn calories when you're not actually working out.
Yeah, it's definitely some lifestyle switches and things to look at changing that may have to adjust, even if you have been active or focused on your nutrition at other points in your life. And I'll definitely put a plug for our health coaching team with that, because that's definitely a resource in areas where we can help women find the plan that's going to work best for you. And really, we look at an approach that's sustainable. It's not a quick fix, and it's not something that's going to help you lose 20 pounds in 2 weeks. We're looking for something that's a long-term change that can fit with your lifestyle, recognizing that your lifestyle might be different right now.
Yeah, and knowing that it's going to continue to change. I tell women, what you do today, you're going to have to continue to alter and change 5 years from now.
Mm-hmm. Yeah, that dynamic process, that dynamic life that we all live.
That's right. But if you embrace that, if you start with that, knowing that I'm going to continue to have to evolve and change, then it's all good. You're not expecting one answer. It's like, okay, I'm just going to tweak it a little bit more. It's like kids, right? You just continue to tweak what you do. And you just know the child I had a year ago is different than the child I'm going to have 5 years from now. But that's okay. You just continue to tweak it.
Amanda, did you have a question on that or comment?
Yeah, I mean, I'm still premenopausal, but all the time in my house, I'm like, well, my pants don't fit the same that they used to, or like, oh, I don't fit in this brand, now I fit in this brand, or I look at a picture of when I was 25 and I'm like, whoa, like, remember when? And so recently, I've done more reading and I've done more stuff to educate myself on the fact that we're all going to get old. It's inevitable. And my husband always says, like, hey, it's a privilege. Like, you worked really hard to get here, and not everybody gets that opportunity. So guess what? If you have hot flashes or cold flashes or your hoo-ha is dry, like, we can work through those things, but not everyone's here today. And I don't think that we give ourselves enough credit for getting to that point. And not that I'm excited to join the menopause group personally, like in a health wise, but I'm like excited to be there too, and have the opportunity to check that box, because not everyone has that opportunity, and it is part of life. And I think that's kind of part of the story. And I'm not there yet, but that's totally how I feel at this point.
And I would say there's a lot of women that go through perimenopause and postmenopause, and they feel so much more empowered in their body, right? They feel like, I know this body so well now. I didn't know this body that well 10 or 15 years ago.
Mm-hmm.
And it's really how you frame what you think. Because now a lot of women come in and be like, it's so great now. I don't have to worry about getting pregnant. Like in your 20s, we're all like, oh my God, I don't want to get pregnant. And now they're like, we don't have to worry about any of that stuff. We're not worried about pregnant. We're just having fun. Like, right? It's great just to have fun and enjoy themselves. So I think it's just all an evolutionary process. And they're like, we don't have all these kids in our house. Now it's just me and my partner or me and my spouse. And it's really just reframing how you think about that time in your life and looking at all the things that are amazing about that time in your life that you wouldn't have if you weren't that age. And really embracing that and being like, this is so good. I never had this before, whatever it is. And looking at it from that perspective, like you said, and a lot of people don't make it that far, right? So just the fact that you're still there is great.
Mm-hmm. And I always think too, I will say that there are women that the thing that age gives you is experience. And there's women that I look up to because there's no amount of education or reading or certifications that you can get that can take the place of true life experience. And so much of what women have when they're in peri and postmenopause, they have life experience that's unique that you can't get without going through that aging process.
Absolutely.
Yeah. Sorry. Oh, go ahead. Go ahead, Amanda.
So I also learned recently, I always thought I wasn't allowed to ask for help for anything. Like, you need a job, don't ask for help. Needed this, don't ask for help. Health-wise, don't ask for help. And the more and more that I evolved, the more and more I was like, oh wait, they might have been through it. Oh wait, they might be able to talk to someone or talk to me or break it down. And like, once I finally realized I could just ask for help, and women have their own like group that no one discusses on the surface, but we're really like the glue that hold everything together. And once I started asking for help and it dawned on me that I could, it was like the floodgates and the ease of going through every day just became like a quick message away or just like a helpful hint. And it's been a night and day experience, just knowing that you should just ask for help and it's okay. Like, it's a healthy thing.
Yeah, that was such a good point in so many areas. Reaching out to other women, reaching out to healthcare providers, reaching out to health coaching, whatever, finding that support network really does help women feel their best during this time. You don't have to be alone. No one has to be alone right now. One other question that we can finish up with, this came in via email prior to the webinar, and this woman asked, she mentioned she wanted to talk about debilitating periods, fibroids, and going through menopause, and how can periods cause shoulder pain? So what's the connection between having a period and pain in their body? As she's going through the menopause change or in perimenopause, she says her body hurts a lot. She feels like it's similar to what fibromyalgia may be. Is there anything they can do? And it's hard to get things done without taking a lot of ibuprofen. Any thoughts on that, Dr. Dooley?
Yeah, so I would say if you have fibroids, just having fibroids on the uterus, depending on where those fibroids are and what they are hitting against, what other organs, that in and of itself can cause pain. I'd say it's almost like being pregnant, right? The uterus is getting bigger and it's pushing on all your other organs, and it's just uncomfortable because it's not supposed to be that way. The same way with fibroids. And so when you are having menstrual cycles, sometimes you can have what we call retrograde menstruation. So a little bit of that blood can get inside of the abdomen, and that can also be very irritating to the abdominal organ. So that can cause pain. But you could just have something like fibromyalgia. And so not uncommon that women will get that later in life, perimenopause and postmenopausal time period. So again, those are things that you want to make sure that you're checking in with your healthcare provider and seeing, because it's easy for them to do in the office to find out if you are having fibromyalgia, so that those things can be treated. In general, most women should not be having more painful menstrual cycles as they're going through the menopause. Like your bleeding should be getting lighter, the pain should be getting lighter, even fibroids should be like decreasing. Every now and then that's not the case, but I'd say probably for 80% of the women, those symptoms should be decreasing. And if they're not, that's a great time and a reason to be checking in with your healthcare provider and just making sure there's not something else that's being missed.
Okay. Thank you for that. Another reason, again, shouldn't be suffering in silence alone. Reach out for help and get support there and answers or diagnosis where needed. Well, as we finish up here, I'd be curious if either of you have any final remarks, any closing comments for our audience. Amanda, I'll start with you to see if you have anything that you've taken away or you want our audience to make sure that they take away.
Ask for help. That's the first thing. I learned it a little too late, I feel like. And then I just feel like maintain having the conversation. It was super great to meet Dr. Dooley. I haven't done that yet. So that was very informative. And I think that's about it. I'm sure I'll have plenty more conversations to share that I have with my girlfriends where we're all confused and we don't know what's going on. So
maybe we'll do a part 2.
Yeah.
And Dr. Dooley, any final remarks, resources, or recommendations for our audience?
I would say the biggest thing is you are your own best advocate. And so you need to feel comfortable advocating for yourself, even when you're just not sure. But I think, I tell women all the time, you know your body better than anybody else. So absolutely feel empowered to talk about it. And know that nothing will ever be normalized if we continue to like whisper in the shadows about whatever is going on. It's up to us. It's up to us as women to make it normal. It's up to us to have those conversations, because the more we have it, the more people around us are going to be like, well, of course we talk about menopause. Of course this is what happens. But really it is up to us. Nobody's going to do it for us. But it's so easy to do once you start having those conversations. It just becomes like, of course, that's what we talk about.
Excellent. Great reminder to wrap up with. And then I'll also remind our listeners as well that in addition to the Health Fix health coaching option, we also have telemedicine. So working with OBGYNs that are specialized in menopause through telehealth, you can schedule that and look at our options for that on our website. So if you're looking to work with a provider to get some of these questions answered, a lot of women will schedule appointments just to ask questions. There won't be a physical exam over the telehealth, but our providers certainly can still prescribe prescriptions if it's appropriate. They can answer questions and certainly give recommendations in terms of different treatment for managing menopause symptoms on the medical side. And then our coaches are all also trained in menopause and can help with the nutrition, the stress management, sleep, exercise, all things that there's a lot of different strategies, but often women need to figure out what's going to work best for them. So we can certainly do that and help you to find the strategies to build your toolkit so you can approach this time of life with a little more zest, a little more ease, and know that it's normal, but there's resources here to support you. Thank you both so much for your time. This is a pleasure talking with both of you. I learned a lot and had a lot of fun. So thank you, Dr. Dooley and Amanda. And maybe we will have a part 2 coming here in the future.
Thanks for having me. So fun.
Thank you.
Thank you.